Influenza is a viral infection that sickens millions of people each year and can cause serious complications, including death, especially in children and older adults. Fortunately, the flu vaccine, available in the form of a flu shot or the flu mist, it offers protection against the flu. The Centers for Disease Control and Prevention has documented that on average, 36,000 people die each year from influenza. Since September of 2008, the CDC has received 53 reports of influenza-associated pediatric deaths alone. As you can see on this chart, the CDC does a wonderful job in charting the statistics that are sent to them weekly from across the country. The chart is broken down by regions in the United States that have reported pediatric deaths. I'd like to interpret some of this information for you. First of all, as I just stated, nationwide, 53 pediatric deaths as a result of influenza. In the New England area, there was 1 death reported since September of 2008. In the Mid-Atlantic region, there were 10 deaths reported. East North Central, 7 deaths. West North Central, 0. South Atlantic, 8. East South Central, 4. West South Central, which I just reported to you, 11 pediatric deaths. Mountain, 8 deaths. And finally, in the Pacific area, 4 deaths that involve children ages birth to 12 years of age due to influenza. According to the Canadian Centre for Occupational Health and Services, taking the following steps can prevent influenza. Number 1, get the flu shot or the flu mist. Number 2, cover your mouth and nose when coughing and sneezing. Number 3, using tissue to contain respiratory droplets. Number 4, washing your hands frequently. Number 5, good personal hygiene practices. When people get the influenza, multiple issues can come into play. Number 1, one must consider the lost time at work, resulting in lost wages and lost productivity. Also, when children get influenza, you're looking at an interruption into the educational process because they're not able to go to school, or in addition to parents, once again, losing time at work because they must stay at home with the children. By getting the flu shot or the flu mist, you can hopefully avoid any of the above situations. When the match between the flu vaccine and circulating strains of the flu virus is close, a flu shot is between 70 and 90% effective in warding off illness in healthy people under age 65. A study published in 2006 showed that the nasal spray flu vaccine, which is called flu mist, was only 30 to 57% effective in preventing the flu in adults. However, what I feel is more important at this time, or in regards to this discussion, another study in 2006 found that giving nasal spray vaccine to school-aged children helped reduce the spread of flu in that community. The flu shot is given with a needle, usually in the arm. The flu shot is approved for use in people older than 6 months, including healthy people and people with chronic medical conditions. The nasal spray flu vaccine is approved for use in healthy people ages 2 to 49 years of age and women who are not pregnant. Yearly flu vaccination should begin in September or as soon as the vaccine is available and continue throughout influenza season into December, January, and beyond. Because of the timing and the duration of influenza seasons vary, this also could vary the time. While influenza outbreaks can happen as early as October, most of the time influenza activity peaks in January or later. At this time, I would like to strongly encourage you and your family to consider getting vaccinated each year. I'm also advocating to our legislators to enact legislation that would require all employers to require and pay for vaccinations for all employees who work directly with children ages birth to 18 years of age, as well as seniors age 65 and older. This would be for those who work in daycare centers, nursing homes, facilities, volunteer centers, and so on. I truly believe that prevention is the key to lowering the number of deaths each year. One death is one death too many. I would also like to see local health departments conduct community awareness programs and flu clinics during what is considered the flu season, as I stated to you earlier. These public awareness campaigns could be conducted in places that are frequented by those in those age groups that I mentioned earlier. Malls, local grocery stores, and play centers would be a great place to start. Finally, I would like to see hand sanitizer dispensers in each and every public restroom. Obviously, these additional steps will cost money. However, I truly believe that money being spent will be recouped in good health dollars. Thank you, and go get your flu shot.